Hello all, hope you're having a great day today. Today we are talking about chapter 14, it's part 2, resistance training. So before designing a training program, a needs analysis of the client should be performed to design the most effective program. Once the needs and goals of the client have been established, the personal trainer or fitness professional can address questions that will come up when designing the workout using the acute program variables. A needs analysis for strength training involves answering some important initial questions that affect the program design components. The needs analysis requires that the following questions be considered. What is the main goal of the resistance training program? What muscle groups need to be trained? And what are the basic energy sources, anaerobic or aerobic, that need to be trained? And what types of muscle action, isometric or eccentric action, should be used? What are the primary sites of injury for the particular sport or prior injury history of the individual? The first question to be asked of the client concerns the main goal for the resistance training program. A discussion with the client of what type of outcome, general health, muscular strength, muscular endurance, muscular hypertrophy, and or muscular power they desire will help the fitness professional develop an appropriate program. Each of the aforementioned program goals will require a different program design to optimize the stated goals. Reviewing these with the client allows for discussion of realistic expectations and time commitments before continuing with more extensive program evaluation procedures. And determining the client's needs and goals, an examination of the muscles and the specific joint angles to be trained needs to be conducted. For any activity, including a sport, this involves a basic analysis of the movements performed and the most common sites of injury. With the proper equipment and a background in basic mechanics, a more definitive approach to this question is possible. With the use of a slow motion videotape, a fitness professional can better evaluate specific aspects of movements and conduct a qualitative analysis of the muscles, angles, velocities, and forces involved. The decisions made at this stage help define one of the acute program variables, choice of exercise. Specificity is a major tenet of resistance training and is based on the concept that the exercises and resistances used should result in training adaptations that will transfer to better performance in sport or daily activity. Resistance training is used because it is often difficult, if not impossible, to overload a sports skill or other physical movement without risk of injury or dramatic altering skill technique. Specificity assumes that muscles must be trained similarly to the sport or activity in terms of the following: the joint around which motion occurs, the joint range of motion, the pattern of resistance throughout the range of motion, through ascending, descending, or bell-shaped, the pattern of limb velocity throughout the range of motion, and the types of muscle contraction, concentric, eccentric, or isometric. Each resistance exercise used in a program will have various amounts of transfer to another activity referred to as transfer specificity. When training for improved health and well-being, transfer is related to its effects on specific clinical outcomes, such as bone mineral density. However, training for enhancing sport performance requires equally specific exercises. Every training activity has a percentage of carryover to other activities, but no conditioning activity has perfect carryover. Although some activities have a higher percentage of carryover than others because of similarities in neuromuscular recruitment patterns, energy systems, and biomechanical characteristics, only by practicing the exact task, such as lifting groceries or shoveling snow, or sport, such as running or basketball itself, is the training 100% transferred. Unfortunately, most of the time one cannot use the specific sport or activity as the training stimulus because it is not possible or safe to gain the needed overload on the neuromuscular system. Thus, this is why resistance training is used in the conditioning process. The optimal training program needs to maximize carryover to the sport or activity. Performance of every sport or activity uses a percentage of all three energy sources. The energy sources to be trained have a major impact on the program design. Resistance training usually stresses the anaerobic energy systems. Adenosine triphosphate, creatine phosphate, or the ATP-CP energy source, and glycolytic energy source more than the aerobic metabolism. Individuals who have gained initial cardiovascular fitness will have difficulty improving maximal oxygen consumption values using conventional resistance training alone. However, resistance training can be used to improve endurance performance by improving running efficiency and economy. In addition, systematic reviews of the literature have reported that concurrent resistance and endurance training has a positive effect on endurance performance among well-trained runners and cyclists. Decisions regarding the use of isometric, dynamic concentric, dynamic eccentric, and isokinetic modalities of exercise are important in planning any type of resistance training program. Not all equipment uses concentric and eccentric muscle actions, and this can impact training effectiveness, such as with hydraulics. Whether for sport, fitness, or rehabilitation, basic biomechanical analysis is used to decide which muscles to train and to identify the type of muscle action involved in the activity. Most resistance training programs use several types of muscle actions. Fitness professionals need to know the prior injury profile of their client and the common sites of potential injury from the sport or recreational activity performed or other daily activities. The prescription of resistance training will be directed at enhancing the strength and function of tissue to better resist injury, enhance recovery if injured, and minimize the extent of damage related to an injury. The term prehabilitation, or the opposite of rehabilitation, has become popular. Prehabilitation refers to preventing initial injury by training the joints and muscles that are most susceptible to injury in an activity, such as a rotator cuff program for throwing athletes. The prevention of re-injury is also an important goal of a resistance training program. Thus, understanding the sports or activities' typical injury profile, such as knees in downhill skiing, elbows and shoulders in baseball pitching, and extended hours of sitting or standing for work. The individual's prior history of injury can help in properly designing a resistance training program. Developed more than 20 years ago, the paradigm of acute program variables allows one to define every workout. Every resistance exercise protocol or workout is derived from 5 acute program variables. The classical acute program variables are choice of exercise, order of exercise, amount of exercise of resistance and number of repetitions, number of sets, and duration of rest periods between sets and exercises. In turn, the choices made for each of the variables define the exercise stimuli and ultimately, with repeated exposure, the training adaptations. Essentially, the choices made for the specific combination of acute program variables create an exercise stimulus fingerprint that is specific and unique to that workout protocol. Thus, by making specific choices for the acute program variables that are related to the needs and goals of the client, the personal trainer is able to create many different types of workouts. The choice of exercise will be related to the biomechanical characteristics of the goals targeted for improvement. The number of possible joint angles and exercises is almost as limitless as the body's functional movements. As muscle tissue that is not activated will not benefit from resistance training, the exercises should be selected so they stress the muscles, joints, and joint angles specified by the client's needs analysis. To aid the personal trainer or fitness professional in making the correct choices, exercises can be divided into several different categories based on their function and or muscle movement. Exercises can be designed as primary exercises or assistance exercises. Primary exercises train the primary movers in a particular movement and are typically major muscle group exercises such as the leg press, the bench press, and hang pulls. Assistance exercises are exercises that train predominantly a single muscle group, such as the tricep press or the bicep curls, that aids, synergists, or stabilizers in the movement produced by the primary movers. Exercises can be classified as a multi-joint or single joint exercise. Multi-joint exercises require the coordination action of 2 or more muscle groups and joints. Power cleans, power snatches, deadlifts, and squats are good examples of whole body multi-joint exercises. The bench press, which involves movement of both the elbow and shoulder joints, is also a multi-joint, multi-muscle group exercise, although it only involves movement in the upper body. Some examples of other multi-joint exercises are the lat pull down, the military press, and squat. Exercises that attempt to isolate a particular muscle group's movement of a single joint are known as single joint and or single muscle group exercises. Bicep curls, knee extensions, and knee curls are examples of isolated single joint, single muscle group exercises. Many assistance exercises may be classified as a single muscle group or single joint exercise. The inclusion of both bilateral, both limbs, and unilateral or single limb exercises in a program will ensure proper balance in the development of the body. Bilateral differences in muscle force production can be developed with one limb working harder on every repetition than the other, leading to an obvious force production deficit and imbalances between limbs. Unilateral exercises such as the dumbbell bicep curl play an important role in helping maintain equal strength in both limbs. Multi-joint exercises require neural coordination among muscles and thus promote coordinated multi-joint and multi-muscle group movements, although multi-joint exercises require a longer initial learning or neural phase than single joint exercises. Including multi-joint exercises in a resistance training program is crucial, especially when whole body strength movements are required for a particular activity. Multi-joint exercises activate several different muscle groups at the same time and thus are time efficient. Therefore, they can be especially useful for an individual or team with a limited amount of time for each training session. Other benefits of multi-joint exercises are included enhanced hormonal response and greater metabolic demands. Be aware that many multi-joint exercises, especially those with an explosive component, require advanced lifting techniques, such as power cleans and power snatches. These exercises need additional coaching, practice, and skill development beyond the basic movement patterns. Almost all sports and functional activities in everyday life, such as climbing stairs, depend on structural multi-joint movements. Whole body strength power movements are the basis for success in most sports. Clearly, all running, jumping, or striking activities, as well as sport-specific movements, such as tackling in American football or a takedown in wrestling or hitting a baseball, depend on whole body strength and power movements. Thus, incorporating multi-joint exercises in a resistance training program is important for all competitive or recreational athletes. The order in which exercises are performed is an important acute program variable that affects the quality and focus of the workout. ACSM recommends that by exercising the large muscle groups first, a superior training stimulus is presented to all of the muscles involved. Exercising the large muscles first is thought to stimulate optimal neural, metabolic, endocrine, and circulatory responses, which may augment the training response to subsequent exercises later in the workout. This concept also applies to the sequencing of multi-joint and single joint exercises. The more complex multi-joint technique intensive exercise such as power cleans and squats should be performed initially, followed by the less complex single joint exercises such as leg extension and bicep curls. The rationale for this exercise sequencing recommendation is that the exercises performed in the beginning of the workout require the greatest amount of muscle mass and energy for optimal performance. This has been observed by Samau et al., who found that performing exercises of both the large and the muscle groups at the end of an exercise sequence resulted in significantly fewer repetitions in the 3 sets of an exercise in both men and women. This decrease in the number of repetitions performed was especially apparent in the 3rd set when an exercise was performed last in an exercise sequence. These sequencing strategies focus on attaining a greater training effect for the large muscle group exercises. If multi-joint exercises are performed early in the workout, more resistance can be used because of less fatigue in the smaller muscle groups that assist the primary muscle movers during the multi-joint exercises. Also, Alternating upper and lower body exercises and or pushing and pulling exercises allows more time for the assisting muscles to recover between exercises. Because the order of exercise affects the outcome of a training program, it is important to have the exercise order correspond to the specific training goals. In general, the sequence of exercises for both multiple and single muscle group exercises should be as follows: large muscle groups before small muscle group exercises, multi-joint before single joint exercises, alternate push and pull exercises for total body sessions, and alternate upper and lower body exercises for total body sessions. Explosive power type lifts or Olympic lifts and plyometric exercise before basic strength and single joint exercises, and exercises for priority weak areas before exercises for strong areas. More intense to least intense, particularly when performing several exercises consecutively for the same muscle group. The amount of resistance used for specific exercise is one of the key variables in any resistance training program. The resistance is the major stimulus related to the changes observed in measures of strength, hypertrophy, and local muscular endurance. When designing a resistance training program, the resistance for each exercise must be chosen carefully. The use of either repetition maximums or the maximal load that can be lifted the specified number of repetitions, or the absolute resistance, which allows only a specific number of repetitions to be performed, is the easiest method for determining resistance. Typically, a single training RM target or an RM target range of 3 to 5 is used. The absolute resistance is then adjusted to match the changes in strength over the training program. Every set is done to failure, such as momentary muscular fatigue, to ensure that the resistance used corresponds to the prescribed number of repetitions. This is because performing 3 to 5 repetitions with a resistance that allows for only 3 to 5 reps produces very different results than performing 13 to 15 repetitions using a resistance that would allow only 13 to 15 reps. Another method of determining resistances for an exercise involves using a percentage of the 1 RM, or 70 or 85% of the 1 RM. If the client's 1 RM for an exercise is 200 pounds or 90.9 kilograms, a 70% resistance would be 140 pounds. This method requires that the maximal strength in all exercises used in the training program must be evaluated regularly. In some exercises, percentage of 1 RM needs to be used, as going to failure or near failure is not practical, such as power cleans or Olympic lifts. Without regular 1 RM testing each week, the percentage of 1 RM actually used during training, especially at the beginning of a program, will decrease and the training intensity will be reduced. From a practical perspective, the use of percentages of 1 RM as a resistance for many exercises may not be administratively effective because of the amount of testing time required. In addition, for beginners, the reliability of a 1 RM test can be poor. Instead, by using the 1 RM target or the RM target or target range, the fitness professional has the ability to alter the resistance in response to changes in the number of repetitions that can be performed at a given absolute resistance. As is the case for any of the acute program variables, the load intensity should depend on the goal and training status of the client. The intensity of the loading as a percentage of 1 RM has an effect on the number of repetitions that can be performed and vice versa. The number of reps that can be performed at a given intensity ultimately determines the effects of training on strength development. If a given absolute resistance allows a specific number of reps, defined as the RM, then any reductions in the number of reps without any increase in the resistance will cause a change in the training stimulus. In this case, the change in the stimulus will lead to a change in the motor units recruited to perform the exercise and thus the neuromuscular adaptations. Differences exist between free weights and machines for percentage of RM used. For example, in a squat exercise, one may be able to perform only 8 to 10 reps, whereas in the leg press, 15 to 20 reps are possible. Differences exist related to the amount of balance and control that is needed in the exercise and the size of the muscle groups. For example, free weight exercises require more neural control and activation of assistance muscles. Also, as the muscle group gets smaller, the magnitude of the response to a given percentage of the 1RM is reduced. The neuromuscular adaptations to resistance training depend on the amount and modality of resistance used. These adaptations follow the SAID principle presented earlier in the chapter. Compared with the lower resistance, heavier resistance will allow lower numbers of repetitions, but will lead to greater improvements in the maximal strength. Thus, if maximal strength development is desired, heavier loads should be used. Alternatively, if muscular endurance is the goal, a lower load should be used, which will in turn allow a greater number of reps, or 12 to 15 repetitions, to be conveyed. Alternatively, adaptations specific to muscular hypertrophy necessitate a differential training style. A recent review of the literature recommends a range of approximately 6 to 12 reps to optimize metabolic stress, leading to hypertrophic adaptations. For more information relative to the guidelines set by ACSM with regard to training, make sure that you check out the tables 14.1, which we'll talk about next. So here you can see the volume associated with the ACSM recommendations for muscular strength. The volume is 1 to 3 sets per exercise. The intensity is about 60 to 70% of a 1RM and 8 to 12 reps with a rest period of 1 to 2 minutes. The frequency is going to be for novice. Sorry, lost my slide. For a novice is going to be 2 to 3 days per week, with intermediate being 3 to 4 days per week. The rest period actually for muscular strength is 2 to 3 minutes between sets for core lifts and 1 to 2 minutes for assistant exercises. And the intensity is 60 to 70% for the 1RM at about 8 to 12 reps. For more advanced individuals, you can do multi-set programs with systematic variations in your volume and intensity. Doing a cycling load of 80 to 100% of the 1RM and progressing to heavier loads of 1 to 6 reps. Again, same rest period for strength gains, but you may want extended rest periods if necessary. And you can do this particular workout 4 to 6 days per week, making sure to alternate between lower body and upper body or split. For muscular hypertrophy, you're going to do 1 to 3 sets per exercise, 70 to 85% of the 1RM. So the intensity is a little bit higher, about 8 to 12 reps. And rest period is 1 to 2 minutes. For novice, they can typically do this about 2 to 3 days per week. For intermediate, you can do 4 days per week for split routines. For more advanced individuals, they can do 3 to 6 sets. With 70 to 100% of the 1RM. Typically, the intensity would be 1 to 12 repetitions per set or 6 to 12 reps for the majority. And the rest period for heavy loading, you're going to do about 2 to 3 minutes and about 1 to 2 minutes if it's a moderate to high intensity. And typically, this would be about 4 to 6 days per week for those preparing for sport, either recreationally or advanced. For muscular power, for novice or intermediate individuals, they're going to do about 1 to 3 sets per exercise at a light to moderate load, and 30 to 60% of the 1RM for your upper body exercises. For lower body, it's about 0 to 60%. And 3 to 6 repetitions, but not to failure. The rest period is about 2 to 3 minutes in between your primary exercises when the intensity is high, 1 to 2 minutes for the assistance exercises for your lower intensity exercises. And typically you're going to do, for novice, about 2 to 3 days per week, intermediate about 3 to 4. For more advanced individuals, they'll do 3 to 6 sets per exercise with heavy loading. They can do 85 to 100% of the 1RM. If they're doing light to moderate loading, it would be 30 to 60% for upper body or 0 to 60% for the lower body. And really the focus is to work on explosive velocity. Here you're going to do about 1 to 6 reps and cycling through, and 2 to 3 minutes between your primary exercises when your intensity is high, or 1 to 2 minutes for those assistance exercises or lower intensity. And typically this is done 4 to 5 days per week to allow for some rest and recovery. So frequency of training, your number of days per week, is another program variable that needs to be determined when developing an optimal resistance exercise program. Factors such as desired outcome, the training status, the competition season for athletes, and type of training session, a full body versus a split routine, are a few of the variables that should be considered when developing the frequency recommendations of a resistance training program. When health-related benefits are the desired outcome for the program, ACSM has proposed that 2 to 3 days per week using a full-body resistance training program are sufficient. However, additional training days may be necessary for intermediate, about 4 to 5 days per week, or advanced trained individuals, about 4 to 6 days per week, for continued strength-related gains. There are additional recommendations for frequency of training when you're working on hypertrophy or muscular endurance or power or motor adaptations are the desired outcome. And I believe we covered all of that in the tables prior to this. The number of sets does not have to be the same for all exercises in a workout program. For a resistance training program, individuals, multi-set programs have been found to be superior for strength, power, hypertrophy, and high-intensity endurance improvements. Additionally, recent meta-analytic research has shown a dose-response relationship too between set number and muscular strength and hypertrophy. These findings have prompted support from ACSM for periodized multiple set programs when long-term progression, or not necessarily maintenance, is the goal. Both single and multi-set programs appear to be effective for increasing strength in untrained clients during short-term training periods, such as 6 to 12 days per week. However, 6 to 12, it has to be like 6 to 12 sets per week, However, multiple set programs are superior for long-term progression. Single set programs are effective for developing and maintaining a certain level of muscular strength and endurance. For some fitness enthusiasts, this level of muscular fitness may be adequate. Also, one-set programs sometimes result in greater compliance by those who are limited in their time for exercise and also need to perform cardiovascular exercise, flexibility exercise, and so on. Having a client do one set is better than no sets at all. However, no study has shown single set training to be superior to multiple set training in either trained or untrained individuals. The number of sets is one of the critical variables in the exercise volume equation. When you look at volume is equal to sets times your reps times resistance. The principle of variation in training, or more specifically periodized training, involves the number of sets and volume performed. Exercise volume is a vital concept in resistance training progression, especially for those who have already achieved a basic level of training or strength fitness. Some short-term studies and most long-term studies support the contention that the greater training stimulus associated with higher volume for multiple sets is needed to create further improvement in progression and physical adaptation and performance. Meta-analytic research has shown that as experience in training increases, the need for greater volumes of training also increases. Use of a constant volume program can lead to a staleness and lack of adherence to training. Making variations in training volume, such as both high and low volume exercise protocols, are critical during a long-term training program to continue to provide appropriate overload stimulus, yet also to provide adequate rest and recovery periods. This concept is discussed later in the chapter under periodization of exercise. The rest periods play an important role in dictating the metabolic stress of the workout and influence the amount of resistance that can be used during each set or exercise. A major reason for this is that the primary energy system used during resistance exercise, the ATP-CP system, needs to be replenished, and this process takes time. Therefore, the duration of the rest period significantly influences the metabolic, hormonal, and cardiovascular responses to a short-term bout of resistance exercise, as well as the performance of subsequent sets. For advanced training emphasizing absolute strength, rest periods of at least 2 to 3 minutes with the possibility of extended rest periods as long as 3 to 5 minutes are recommended for primary large muscle mass multi-joint exercises such as the squat or the deadlift, whereas shorter rest may be sufficient for assistant, smaller muscle mass single joint exercises. For novice to intermediate resistance exercise protocols, rest periods of 2 to 3 minutes may suffice for large muscle mass multi-joint exercises because the lower absolute resistance used at these training level seem to be less stressful to the neuromuscular system. Performance of maximal resistance exercises requires maximal energy substrate availability at the onset of the exercise and thus requires relatively long rest periods between sets and exercises. Based on a recent review, a minimum of 3 minutes rest is recommended when training for muscular power, such as plyometric jumps, due to the need to perform maximal effort movements. Ultimately, when training for muscular hypertrophy, shorter rest intervals of 30 to 60 seconds between sets is advocated. The shorter rest interval stimulates greater hormonal activity associated with the hypertrophic effect. Resistance training that stresses both the glycolytic and ATP-CP energy systems appear to be superior, enhancing muscle hypertrophy, such as for bodybuilding. Thus, less rest between sets appears to be more effective and high levels of muscular definition. If the goal is to optimize both strength and muscle mass, both long rest with heavy loading and short rest with moderate loading types of moderate protocols should be included. However, it should be kept in mind that short rest resistance training programs can potentially cause greater psychological anxiety and fatigue because of the greater discomfort, muscle fatigue, and high metabolic demands of the program. Therefore, psychological ramifications of using short rest workouts may be carefully considered and discussed with the client before the training program is designed. The increase in anxiety appears to be associated with the high metabolic demands found with short rest exercise protocols of 1 minute or less. Despite the high psychological demands, the changes in mood states do not constitute abnormal psychological changes and may be a part of the normal arousal process before a demanding workout. The key to determining optimal rest period lengths is to observe the client. Symptoms of loss of force production in the beginning of the workout and clinical symptoms of nausea, dizziness, and fainting are clear signs of the inability to tolerate the workout, which when such symptoms occur, the workout should be stopped and longer rest periods used in subsequent workouts. With aging, rest periods need to be carefully heeded. Aging decreases the ability to tolerate changes in muscle and blood pH and underscores the need for gradual progressions of cutting rest periods between sets and exercises. Typical rest periods are characterized as either very short rest periods of 1 minute or shorter, short rest periods of 1 to 2 minutes, moderate rest periods of 2 to 3 minutes, and then long rest periods of 3 to 4 minutes, with very long rest periods being 5 minutes or longer. The heavier the resistance, the more rest that should be allowed between sets and exercises. Also, more rest allows for a greater number of repetitions to be performed at a specific RM load. The gradual use of shorter rest periods stimulates improvements in the body's blood bicarbonate and intramuscular buffering systems. As long as the demands placed on the neuromuscular system are similar, the acute program variables can be manipulated in various ways to develop different workouts for the single exercise sessions used over time. The number of sets, reps, relative resistance used, and rest periods do not have to be the same for each session exercise in a session. They can be varied either within an exercise or more frequently between different exercises in an exercise protocol. The use of light exercise levels can be used when it is necessary to rest higher threshold motor units or motor neuron and associated muscle fibers. Motor recruitment follows a size principle because not all motor units are recruited with each exercise or resistance loading or contraction of a muscle. Different loadings can result in varying amounts and types of muscle tissue being used. Heavier loads with adequate volume recruit more muscle tissue than high repetitions of lower levels. Understanding and using the size principle is vital for developing variation and resistance training and ultimately periodized training. Muscles produce forces while performing one of three different actions. When sufficient force is produced to overcome the external load and shorten the muscle action is termed a concentric muscular action or contraction. When the muscle produces force but there is no change in the length of the muscular action is termed an isometric muscle action. And when the production of force occurs when the muscle is lengthening or resisting the movement, the muscular action is termed an eccentric muscular action. In the past, the term contraction was used for each of the three muscle actions. However, only concentric muscle actions actually involve a classic muscle shortening or true contraction. Any exercise can include any combination of the three muscle actions. However, most exercises are performed using either isometric muscle action or both concentric and eccentric muscle actions. However, the most effective training program appears to use concentric and eccentric repetitions, so a shortening or lengthening. The skeletal muscle force velocity relationship pattern encompasses high to low speed eccentric muscle actions, maximal isometric muscle actions, and slow to high velocity concentric muscle actions, creating a descending hierarchy of force production. And here you can see the mode of action, the primary movers, the agonists and antagonists, as well as the synergists and fixator muscle groups. Muscle actions involving movement of a joint are termed dynamic, and thus exercising involving joint movements are called dynamic exercises. A full range dynamic exercise usually contains both a concentric phase and an eccentric phase. The order of the phases depends on the choice of exercise. A squat, for example, starts with the eccentric phase, whereas a pull-up normally starts with the concentric phase. It is important to perform the exercise so that the joints involved move through a full range of motion. This is especially true for single joint exercises. For example, in the arm curl, a full repetition should start with the elbow almost completely extended, progress until the elbow is maximally flexed, and finish with the elbow almost completely extended again. By using the whole RM or range of motion, the whole length of the muscle is stimulated, leading to adaptations throughout the whole muscle. However, range of motion may need to be carefully monitored and perhaps restricted when working with clients who have orthopedic injuries or limitations or anatomical joint laxity, such as in the knee, elbow, or shoulder. And this concludes our discussion today. We will be picking it back up in part 3 in our next session. Thank you. Have a great day today.